Hello, my name is Cynthia Reyes, and I'm with Caitlin Owens, and today we're going to discuss urinary obstruction in your pet and why this is an emergency situation that needs to be addressed immediately in order to save the life of your beloved pet. So what is urinary obstruction? It's the inability of your pet to urinate due to blockage of the ureter with some sort of obstruction. This obstruction can be the result of several different conditions, and we will break them down for you. While blockage is most common in male cats, it can also occur in dogs as well as females of both species. The most common causes of urinary obstruction are calculi, urethral plugs, tumors, scar tissue, and blood clots. This presentation will focus on the first three, as they are the most common. However, all of them have the potential to cause urinary blockage, and all are of concern. Calculi is a term used to refer to stones typically made of numerous small crystals of various substances that are formed within the urinary tract due to the presence of acidic or alkaline urine. The most common types of calculi are struvite, calcium oxalate, and urate. A common factor for the development of calculi is diet-related. If your pet is prone to stone formation, their diet can play a role in the quantity of stones formed and their risk factors for development. We will talk about diet changes that can be made to prevent stone formation in at-risk animals later in the presentation. Urethral plugs are firm, mucoid collections of debris that include small crystals, proteins, and cells that can develop as the result of infection or chronic inflammation of the bladder lining. Plugs are more common in male cats than in dogs, but that doesn't mean that your dog could not develop an obstruction as a result of a urethral plug. Tumors can also be one of the leading causes of urethral obstruction. The tumor can be either benign or malignant and can often grow large enough to stop the passage of urine out of the bladder. Some of the most common tumors that can cause urinary obstruction are those that are located directly in the bladder or further down in the urethra. Signs of a tumor causing urinary obstruction are similar to those seen with calculi and urethral plugs.
So in order to understand how the urinary tract is affected, let's do a quick review of the different components of the urinary tract as well as how they function together. Even though the animal is unable to urinate, it does not mean that the animal stops producing urine. Urine is produced in the kidneys and travels down the ureters to the bladder. The bladder stores the urine until it is released along the urethra into the environment. This process works the same in male and female animals. Female animals have a more direct path and a shorter urethra to eliminate urine, which makes them less prone to blockage. Males, on the other hand, have a long urethra that must bend around bony structures, making them more prone to blockage. If a blockage occurs, this does not mean that the urine is no longer being produced. The kidneys are still functioning normally, however, the bladder is not able to empty and will continue to collect urine beyond its capacity. The kidneys will eventually stop functioning and enter renal failure, a condition that can quickly lead to a number of systemic problems, multi-organ failure, and eventually death. On the slide in front of you, you can see an example of a radiograph showing a bladder filled with stones that are causing a urinary blockage in this animal. Stones can often be visible on radiographs, which is why a radiograph can be an excellent tool for diagnosing urinary obstruction. Here is another example of a radiograph, only this time the stones are present within the urethra. You can see the small line of stones blocking the passage of urine, similar to the illustration on the right-hand side. As you can see, these stones will prevent any urine from escaping the bladder, causing the bladder to quickly become overly distended. A typical male cat produces approximately 2 teaspoons of urine every hour. Urinary obstruction in pets is an emergency situation. Failure to clear the blockage can result in the death of your pet in less than 24 hours. If you notice your pet displaying any of the symptoms or signs we will describe in the next section, it is important to call your veterinarian and get your pet in as soon as possible. If it is not during regular business hours, find the nearest emergency veterinary clinic to bring your pet to.
Regardless of the cause of the obstruction, signs and symptoms will be similar. However, there are minor differences between cats and dogs. The most common signs of obstruction are straining to urinate, a painful abdomen when it's touched or an oversized bladder, vocalization, nausea and vomiting, lethargy, weakness, or collapse. In the graphic above, you will notice both a relaxed and strained posture during cat urination. During strained urination, the cat's back may be arched, they may exhibit a hunched posture, and they may vocalize due to pain, in addition to having tense muscles and holding the hind legs forward and vertically. Inability or straining to urinate may resemble sometimes constipation. You may also notice your animal repeatedly attempting to urinate in the litter box or outside without any urine being produced.
So how exactly will urinary blockage be diagnosed once you arrive at your veterinary clinic or the emergency room? If diagnosed quickly, urethral blockages are most often treatable. In cats with signs of urinary tract inflammation, blood work is evaluated to check kidney function and to determine if there is any evidence of infection or other systemic illnesses. A urine sample is evaluated for crystals and may be sent in for culture, although bacterial infections of the bladder are uncommon in cats. X-rays of the belly may be taken to see if calculi, or stones, or other material are present in the kidneys or bladder, and your primary care veterinarian may also inject a contrast material into the bladder during X-rays to see if there are any anatomic causes for straining and bloody urine, such as a bladder wall defect or a stricture or narrowing of the urethra. Depending upon the capabilities of your veterinary clinic, ultrasound may also be used to diagnose stones. As toxins build up in their system, this may affect the functioning of their heart. In these cases, an ECG will be used to continuously monitor heart rate and rhythm. While urinary catheterization is often the treatment of choice in extreme situations, a catheter can be used to manually dislodge potential stones prior to the diagnostics already discussed.
So how is blockage treated? When a pet experiences a urinary blockage, hospitalization will be required for several days. Sedation or general anesthesia is needed in all but the sickest patients to allow placement of a catheter into the urethra to flush out the plug or force the stone back into the bladder. The bladder will be thoroughly flushed and drained through the catheter to remove any remaining sediment. The urinary catheter is then typically left in place for 24 to 72 hours until urethral swelling subsides. Once the catheter is removed, the cat is then evaluated to make sure it can urinate freely before it can be discharged from the hospital. Continuous IV fluids will be provided during hospitalization to flush toxins from the system and to prevent dehydration. In cats with bladder stones that can be flushed into the bladder, a cystotomy, which is a surgical opening of the bladder, may be performed to remove the stones. If your cat has multiple occurrences that cannot be unblocked or managed medically and does not have any underlying conditions that could cause recurrence, your veterinarian may recommend a perineal urethrostomy, also called a PU, which is a surgical widening of the urethra. This procedure is intending to provide a permanent opening that allows crystals, mucus plugs, or small stones to pass out of the urethra. This minimizes the chance of reobstruction. If your male cat is receiving a perineal urethrostomy, castration is performed at that same time if the cat is intact.
Now that you know how to treat urinary blockage, what are some complications that could occur during the unblocking procedure? Because reversal of urethral obstruction can be traumatic to the tissues, tears and/or scarring of the urethra, incontinence, and bladder dysfunction are possible problems. If the bladder ruptures, urine can enter the abdomen, which is also called a uroperitoneum, and can cause infection. In the event of a cystotomy or urethrostomy, the incision may develop post-surgical complications including bleeding or herniation at the site. Irritation of the skin from urine leakage, which is also known as scalding, can occur if proper sanitation techniques are not maintained at home. Bacterial urinary tract infections can occur due to the presence of an indwelling urinary catheter, as well as due to a secondary cause to the perineal urethrostomy. As we mentioned earlier, urethral blockage is an emergency. Even if treatment is attempted, in some cases the pet may not survive the blockage or subsequent treatment.
So what can you expect after treatment? Post-op and aftercare treatment for urinary obstruction includes restricting the patient to cage rest for several days following discharge from the hospital. Pelleted or paper litter may be required for several days after surgery. An Elizabethan collar is kept on the cap for 10 to 14 days after surgery to prevent self-trauma, which can be devastating to the outcome of the surgery, or if significant swelling is present. You may notice that the frequency of urination will increase for several weeks, as well as the tendency for the animal to have urine accidents. This is most often related to the irritation of the urethra and bladder and will likely resolve once the inflammation has subsided. Blood in the urine is also a result of inflammation and/or trauma to the urethra and bladder and should resolve as well. Pain control and antibiotics will be prescribed to your pet upon discharge and should be given as instructed. Importantly, your pet should be provided with free access to fresh water and encouraged to drink as frequently as possible. Water intake is incredibly important in allowing the urinary system to continue to perform its job of eliminating systemic toxins. Further, your pet will likely be given a special prescription diet to assist in prevention of stone formation in the future.
Once treated, how likely is this treatment to be effective? Inappropriate diets or overfeeding can be one of the leading causes of urinary obstruction in pets. A dietary change may be necessary in order to keep your pet healthy and decrease the chance of a urinary obstruction occurring again. There are many commercial diets now that are available through companies such as Hills and Royal Canin that are designed specifically to help keep your pet's urinary system healthy, as well as help treat developing stones or prevent them from forming in the first place. For example, Hills SD was designed to dissolve struvite stones, which are formed in acidic urine. This is done by minimizing the amount of magnesium and phosphorus in the diet to maintain a proper body pH. Keeping your pet hydrated, as mentioned before, is one of the keys to helping prevent your pet from re-obstructing. There are many ways that you can help improve your pet's hydration status, such as feeding wet food, having multiple water dishes throughout the house, or even flavoring the water with something safe for the pet to ingest. Blood work and urine should be rechecked for signs that could suggest either infection due to a UTI, as well as to evaluate the kidney function.
Even after treatment, what is the likelihood that this will happen again? The answer is very likely. With proper diet, increased water consumption, and medications, the likelihood of reobstruction is significantly reduced. It's important to monitor the flow of urine to ensure that there is no visible signs of complication. However, cats are especially prone to repeat obstructions due to their tendency for uncontrolled urethral spasms and may reblock within 7 days following removal of the indwelling catheter. Long-term dietary changes may be necessary to prevent crystals, stones, or other potential causes of the obstruction. Ensuring a cat has a clean and safe litter pan will also help. Some causes of urethral obstruction can be treated and eliminated, others cannot. Therefore, careful monitoring the pet and follow-up visits to your veterinarian are very important following an obstruction event. For additional information on urinary blockage and special diets available for prevention, above is a list of the following websites, or please visit the following websites. Thank you for your time.